Welcome back to our channel. Today, we're diving into the significance of the rotavirus vaccine and how it plays a crucial role in protecting children from this potentially severe illness. So, let's get started. What is rotavirus? Rotavirus is a highly contagious virus that primarily affects infants and young children. It causes severe gastroenteritis, characterized by vomiting, diarrhea, and dehydration. Rotavirus infections are a leading cause of diarrhea-related illness and death worldwide, particularly in developing countries. Vaccination against rotavirus is highly effective in preventing severe cases and reducing hospitalizations associated with the virus. What is rotavirus vaccine? The rotavirus vaccine is a preventive measure designed to protect infants and young children from rotavirus infection. It is administered orally in the form of drops and is typically given in a series of 2 or 3 doses. The rotavirus vaccine has been proven to be safe and effective in reducing the incidence of severe rotavirus gastroenteritis, hospitalizations, and complications associated with the virus. By getting vaccinated, children can develop immunity against rotavirus and significantly reduce their risk of severe diarrhea and dehydration. How rotavirus vaccine is manufactured. Live attenuated rotavirus vaccines are manufactured using a different process compared to inactivated vaccines. Here is a simplified overview of how live attenuated rotavirus vaccines are typically manufactured. Isolation and characterization. Rotavirus strains are isolated from clinical samples and characterized to determine their genetic and antigenic properties. Attenuation. The rotavirus strains are then subjected to a process called attenuation. This involves modifying the virus to make it less virulent or harmful while retaining its ability to induce an immune response. Attenuation can be achieved through various methods, such as repeated passage of the virus in cell culture, genetic manipulation, or reassortment techniques. Viral replication. The attenuated rotavirus strains are cultured in specialized cells under controlled laboratory conditions. These cells provide an environment for the virus to replicate, allowing for the production of a sufficient quantity of the attenuated viral particles. Harvesting and purification. Once the viral replication is complete, the cell culture is harvested, and the virus particles are separated from the cellular components and other impurities through purification techniques such as filtration and centrifugation. Formulation. The purified attenuated rotavirus particles are combined with stabilizers, adjuvants, and other vaccine components to create a final vaccine formulation. These components help maintain the stability of the vaccine and enhance its immune response. Fill and finish. The formulated vaccine is filled into vials or pre-filled syringes under sterile conditions. The containers are sealed to prevent contamination. Quality control. The manufactured vaccines undergo comprehensive quality control testing to ensure their safety, potency, and purity. These tests involve assessing the vaccine's physical properties, verifying its genetic stability, and checking for the absence of contaminants. Distribution. After passing the quality control tests and regulatory approvals, the live attenuated rotavirus vaccines are packaged, labeled, and distributed to healthcare providers and vaccination programs for administration to the target population. It's important to note that the specific manufacturing process for live attenuated rotavirus vaccines can vary depending on the manufacturer and the specific vaccine being produced. Each manufacturer follows strict regulatory guidelines and quality control measures to ensure the safety and effectiveness of the vaccine. How rotavirus vaccine work? Live attenuated rotavirus vaccines work by introducing weakened, but still viable, forms of the virus into the body. These vaccines contain rotavirus strains that have been modified or attenuated to reduce their virulence while retaining their ability to stimulate an immune response. Here's how live attenuated rotavirus vaccines work. Oral administration. Live attenuated rotavirus vaccines are administered orally, typically in the form of drops. The vaccine is ingested, allowing the attenuated virus to reach the gastrointestinal tract, where rotavirus infections primarily occur. Replication in the gut. Once inside the body, the weakened rotavirus strains replicate and multiply in the cells lining the intestines. This replication process triggers a localized immune response in the gut. Immune response. The replication of the attenuated rotavirus stimulates the immune system, leading to the production of specific antibodies that recognize and target the virus. These antibodies, known as immunoglobulin A, IgA, are predominantly found in the mucosal linings of the gut and act as the first line of defense against rotavirus. Immune memory. The immune system also generates memory cells that remember the specific characteristics of the attenuated rotavirus. This memory response allows the immune system to mount a rapid and robust defense if the individual is later exposed to the same virus. Protection against re-exposure of virus. In the event of subsequent exposure to wild-type rotavirus, the immune system recognizes the virus and quickly mounts an immune response, including the production of antibodies and activation of immune cells. This response helps prevent the virus from causing severe illness or reduces the severity and duration of symptoms. By inducing an immune response in the gut, live attenuated rotavirus vaccines provide localized immunity at the site of infection. This immune response helps reduce the severity of rotavirus gastroenteritis, prevent complications, and lower the risk of hospitalization. It's important to note that live attenuated rotavirus vaccines are designed to closely mimic natural infection, stimulating a robust immune response without causing severe illness. However, the attenuated strains in the vaccine are much less virulent than the wild-type rotavirus strains, significantly reducing the risk of severe disease associated with natural infection. Who require rotavirus vaccination? Rotavirus vaccination is recommended for infants and young children as they are the most susceptible to severe rotavirus infections. Here are the general recommendations for rotavirus vaccination. Age. Rotavirus vaccination is typically given to infants starting at around 6 to 15 weeks of age. The specific age may vary depending on the country or region's immunization schedule. Dose schedule. The rotavirus vaccine is usually administered in a series of 2 or 3 doses, depending on the vaccine brand. The doses are typically given at 2, 4, and 6 months of age. It's important to follow the recommended schedule provided by healthcare providers. Maximum age. The maximum age for the first dose of rotavirus vaccine is usually around 14 to 15 weeks. The final dose should be administered by 8 months of age. It's essential to consult with healthcare providers for the specific age limits and schedules in your area. Preterm infants. Preterm infants may also be eligible for rotavirus vaccination, but the timing and number of doses may differ from those given to full-term infants. Additionally, it's crucial to prioritize rotavirus vaccination for infants and children who are at higher risk of severe disease or complications, such as those with certain underlying medical conditions. Healthcare providers can assess the individual risk factors and determine the need for vaccination on a case-by-case basis. Remember, vaccination not only protects the vaccinated individual but also contributes to community immunity by reducing the overall circulation of the virus and protecting those who are too young or unable to receive the vaccine. What are the AEFI associated with rotavirus vaccination? Adverse events following immunization, AEFI, associated with live attenuated rotavirus vaccination are generally rare and mostly mild. However, it's important to be aware of potential AEFI. Here are some AEFI that have been reported, though they occur infrequently. Gastrointestinal symptoms. Since rotavirus vaccines are administered orally, mild gastrointestinal symptoms can occur. These may include temporary diarrhea, vomiting, or mild gastrointestinal discomfort. These symptoms are usually self-limiting and resolve without complications. Intussusception. Intussusception is a rare but serious condition where one segment of the intestine slides inside another, causing a blockage. Studies have shown a small increased risk of intussusception within a week to a month after rotavirus vaccination. However, the overall risk is still very low compared to the risk of natural rotavirus infection. Allergic reactions. Severe allergic reactions to rotavirus vaccines are extremely rare. However, as with any vaccine, there is a small risk of allergic reactions such as hives, difficulty breathing, or swelling. These reactions require immediate medical attention. It's important to note that the safety of vaccines is closely monitored by health authorities and extensive surveillance systems are in place to detect and investigate any potential AEFI. Vaccine safety monitoring helps ensure that vaccines continue to be safe and effective. Conclusion. Wrapping up, the rotavirus vaccine is a vital tool in protecting our children from severe diarrhea and its complications. By ensuring that your child receives the recommended doses, you are not only safeguarding their health but also contributing to the overall well-being of the community. That's it for today's video. We hope you found this information valuable and informative. Remember, vaccination is a powerful tool that helps us build a healthier future for our children. If you have any questions or experiences to share, please leave them in the comments section below. Don't forget to like and subscribe to our channel for more health-related content. Stay healthy, everyone.